um, non-partisan or a non-ideological independent newspaper. I refer to ourselves as an equal harassment newspaper. Your neighborhood equal harassment newspaper, something like that. So I'm really very happy that you could join us this morning. But first, I want to thank our sponsor, Magellan Health. Magellan Health is a Fortune 500 company. It is a leader in managing the fastest growing, most complex areas of health, including special populations, complete pharmacy benefits, and other specialty areas of healthcare. Magellan Health supports innovative ways of accessing better healthcare through technology while remaining focused on the critical personal relationships that are necessary to achieve a healthy, vibrant life. Magellan's customers include health plans and other managed care organizations, employers, labor unions, various military and government agencies, as well as third-party administrators. For more information, you can visit magellanhealth.com. As I mentioned, we have a great panel this morning. Dr. Carney, who is the Chief Medical Officer of Magellan Rx Management, is joining us this morning. Dr. Carney is the Chief Medical Officer for Magellan Rx Management. She joined Magellan Health in 2016 and previously served as the Chief Medical Officer for Magellan Healthcare. In her current role, Dr. Carney is broadly responsible for supporting Magellan Rx in building differentiated, industry-leading clinical programs and services. Prior to her time at Magellan, Dr. Carney also served in Chief Medical Officer roles, working with Medicare, Medicaid, commercial, and exchange populations. She is a published author and co-author of over 100 peer and non-peer-reviewed publications, including a wide array of topics from eating disorders, illness fears in the general population, receipt of clinical preventive medical services among psychiatric patients, and post-traumatic stress disorder and physical health status among U.S. military personnel. Dr. Carney earned her medical degree as well as her master's degree in science from the University of Iowa College of Medicine. Also joining us this morning is Dr. Varun Choudhary. Dr. Varun Choudhary is joining us from Virginia, by the way, from out of Arizona. Dr. Choudhary is a board-certified forensic psychiatrist who rejoined Magellan Health in July of 2019 as the National Behavioral Health Chief Medical Officer. Dr. Choudhary has worked in the mental health industry for over 16 years, providing care to patients in the public sector, correctional arena, private practice, and community-based settings. He has been consultant to the Medicaid Fraud Control Unit in Virginia in the past and is currently the governor-appointed psychiatrist to the State Behavioral Health Board for the Commonwealth. Dr. Choudhary has been a practicing telepsychiatrist since 2006 and previously helped to develop telehealth departments in 2 different companies. Dr. Carney, tell us where you are right now. And
I am in Ahwatukee here in Arizona.
Oh, in Ahwatukee, Arizona. Perfect. Awesome. And I'm glad you could join us this morning. Thank you again.
Thank you.
And Dr. Choudhary, you're joining us from Virginia. How's your morning so far?
So far, so good, aside from the technical difficulties I'm experiencing right now. So hopefully I can get back on camera.
Okay, all right, no problem. We can hear you fine and well, so that's awesome. You know, just before the break, we were talking about how you yourselves are coping with self-isolation. Just a little bit about Arizona for our attendees. The governor of Arizona, Governor Doug Ducey, issued a stay-at-home order yesterday, which means that in theory, you're only allowed to go out if you're doing essential services, and that would include doing your grocery. If you have to travel to take care of your patients or a family member, for example, or you're part of what's considered as an essential business. For example, if you're working in a hospital, that is considered an essential business, or if you're working in a grocery store, that is also considered an essential business. Dr. Carney, let me ask you this: you're just at home, and how are you managing with? Well, let me back up a bit. How did you respond to the governor's stay-at-home order?
Actually, I have a little bit of a funny story about that. My daughter, who is at Barrett, the Honors College at ASU, has decided to remain on campus because she likes her independence of living in the dorms and being around a classmate who is unable to get back to her family. So she's there supporting her. And she called last night after she heard about the order, was crying and saying, I can't see you for 30 days. Can I come home one more time? And so what I did last night after the order came out was to sit with my family and explain to them what the order meant, what the essential services were, and that it didn't completely mean you couldn't see people that you loved, and talk to them about other ways that we can still connect even if we are apart from each other. So it was a great point of being able to educate the family about what the executive order meant and what the importance of it means. As for being at home, I'm really fortunate because when I joined Magellan in 2016, I was an at-home worker. So I've had a few years of experience doing this, and I like to think that I now can serve as a good resource for my colleagues at Magellan and across the country as they have made this move to full-time working at home. It's been a huge adjustment for many, many people across the country.
And Dr. Choudhary, tell us about your situation in Virginia. Are you late to the stay-at-home order like Arizona is?
We are actually. So officially, I believe it went into effect the same way Arizona has it just yesterday or day before with the governor. Previous to that, it was more of a honor system where the governor had mentioned that, we're not doing shelter at home, but make sure that you stay at home, that there's no congregation, and it didn't appear like people were really listening to the orders, and people were at the beaches and whatever else. So yesterday it went fully into effect.
Yep. So want to tell our attendees, of course, that if you have questions, please don't hesitate to send it to me, or send it, just type in your questions via our chat room here, and we'll try to get through those. Or if you want, you can also send me your questions via Twitter. You can find my my Twitter handle is at El Del Puerto. So that's LDELPUERTO at El Del Puerto. So you can send your questions to Dr. Carney and to Dr. Choudhary. Of course, I want to emphasize that healthcare is very individualized, and so our panelists this morning will try and provide us some sort of a broad outline, if you will, about how to cope with this very unprecedented situation in which we all have to self-isolate, socially distance, and some of us have had to self-quarantine. So be sure to consult your own doctors about your healthcare, because it is very individualized. So here's what we know so far. At least 26 states have issued stay-at-home orders, and that affects roughly 229 million people. As I mentioned yesterday, the governor of our state, Arizona, also issued a stay-at-home order. Let me begin with Dr. Choudhary. Dr. Choudhary, you practiced telepsychiatry for a number of years. What kinds of behavioral or mental problems arise out of prolonged self-isolation? When we're socially distancing, we don't really have physical interaction. What kinds of problems do we anticipate to see, or we're already seeing?
The challenge of something unprecedented like this is the fact that we're all social creatures, and oftentimes really you have people who gain a lot of energy and meaning when they're with others. When we're asked to self-isolate, it could sometimes exacerbate underlying mood disorders, underlying anxiety disorders. Prolonged isolation can really start to impact people's mental health, and that's the reason it's really important to really try to keep a balance in a routine. Make sure that you are taking care of yourself properly, eating well, exercising well, and spending time with your loved ones, either your family at home, or if you live alone or have limited interaction with family, getting on video chat or something like that. Just continue to maintain those connections.
Thank you. And Dr. Carney, well, obviously we haven't encountered anything quite like where we're encountering right now. I'm just wondering though if there are parallels or similar cases to what we're having to go through. I'm wondering, for example, if our prolonged isolation is comparable to, say, like isolation in a hospital for a number of days, or maybe even in a jail setting.
There are some parallels to this. While we haven't ever lived as a country through anything like COVID-19, I think some things that we can look at might be prolonged isolation in a hospital, individuals who have been in bone marrow treatment, for instance, have prolonged stays away from individuals and in often cases are unable to touch someone. And the only interaction they have face-to-face may be with a nurse or a physician. So those are some models that might work. I think more importantly, a model that we've seen in the United States are natural disasters. So when a natural disaster strikes, we're often asked to leave our homes, leave our belongings behind, and move into situations that represent to us a loss of some of the personal freedoms that we previously had enjoyed. I think that might be one of the closest parallels. Of course, the difference here is that we're staying in our homes, which is something that I think is helpful for many of us. I don't like to compare this to the sense of being in jail because we maintain most of our liberties in this situation. We haven't done anything wrong. We're in fact trying to do something that's right. And we still have essential services that we're able to access and all the freedoms of connecting to our loved ones through social media or digital media. And I think that comparing it to jail puts a negative connotation on a very positive thing that we're trying to do to help society.
Yeah, I think that's a really good point. I was just thinking about the fact that we're probably as prepared as we can be for something like this. If you go back, for example, to the 1918 flu pandemic, they obviously did not have the kinds of technologies that we enjoy right now. The internet allows us to socially connect, and you're absolutely right. We are. It's not a jail situation. One of our attendees mentioned that this may be something similar to Katrina, and the difficulties that the folks in that state had to go through. Except we have electricity and we have we have the internet. We can buy things online. For example, I had to go do grocery via Instacart for the first time, and I thought the experience was great. Dr. Choudhary, do you actually have cases that you're seeing right now, difficulties or challenges that in your patients, for example, as a result of this self-isolation? I think some states have been under it for longer than Arizona or Virginia.
Correct. And I apologize. It looks like I've lost internet connection at home, so good thing I'm on the phone right now. There have been states that have been harder hit and have been in a shutdown type situation for a period of time. What we're seeing is that people, while they're undergoing a great amount of stress with the situation, we've got people who really are stepping up and they're being resilient, and they are able to help their neighbors or help other individuals who are experiencing the stress of this. So what I've seen is there's been an uptick in telehealth sessions, but in a good way. People are reaching out and really trying to get the help they need. And given the fact that this is such an anxiety-provoking situation, people really are being resilient and making sure that they're taking care of their family and themselves.
Thank you. Just a quick follow-up question to that one. What are the signs, if you will, that we should watch out for, that could alert us to potential problems? Because we're in a prolonged self-isolation. Could be a couple weeks.
Of course, of course. Now, usually you'll look at signs of distress. So, feelings of numbness or disbelief, anxiety, fear. There could be changes in appetite, energy level, activity level, sleep disturbances, nightmares, maybe. Some people who have gone through trauma in the past, this could be triggering for them. There could be physical manifestations of symptoms such as headaches, stomach aches, body pains, those kind of things. People can become short-tempered or really edgy. So a lot of these kind of things will come out as signs of distress. Keep in mind that some people, that there'll be a population who will have a greater stress reaction. For example, people who have underlying mental health conditions. Also, children and teenagers will react differently sometimes than adults will to these situations. So it's really important to make sure that families are monitoring and making sure that the children are okay, and also people with pre-existing mental health conditions, making sure that they are taking care of themselves, taking their medications as prescribed, and seeing their healthcare professional if need be.
So let me hone in on anxiety, for example, and stress. And my wife is a healthcare worker, so she's in the front lines, and I can tell you that in the last couple of days that I've been working from home and she's having to go out there and work, it's been very stressful for her. Her anxiety levels are pretty high. She's worried about bringing home the COVID-19 virus and potentially infecting my mom, who lives with us. She's 79 years old. My mom is. So she's in that category that are with really high risk. So she's very anxious about that. Of course, we're doing everything we can sort of try and prevent that from happening. But she is working in a hospital setting, and cases in Arizona are expected to peak maybe sometime in April. And so we might see the worst yet before things get better. So Dr. Carney, for somebody like a healthcare worker, like my wife, whose stress levels are, pretty high, what kind of how would you go about managing this, and what would you tell our health workers?
I would first recommend to her to acknowledge the fact that she's feeling that way and to talk openly about it to you at home and to her other colleagues at work. I imagine that many of them feel similarly, and that sense of being together and working as a team through something like this can often be very helpful. I would also ask that she looks at what she has and her colleagues have under their control, that they can still take the measures that they need to protect themselves and to protect their patients as much as they can by following procedures, by using PPE when, and hopefully it's available to all of them, and paying attention to the kinds of things at work that are in their control and using each other as a support system. When she comes home, the kinds of things there that she has control over are her personal hygiene coming into the house, keeping her hands clean, changing her clothes, doing the things that she needs to do before being around you and your son and your mom. But she needs to take care of herself also, and that taking care of herself means a couple of different things. With regard to her physical health, still maintaining some sort of exercise program and working on getting the best sleep that she can. Sleep is something that helps anxiety a great deal and helps kind of protect against some of the negative feelings that we can have in this situation. She also needs to help take care of her mental health by continuing to connect to her support system, whether that's family or friends, and colleagues when they're away from work. And recognize the signs that she may be feeling that Dr. Choudhary just mentioned, the feelings of anxiety that creep up that may first manifest as a physical feeling, just not feeling well or having that sense of being emotionally drained. And unfortunately, in some folks, that can end up as irritability and in more extreme forms, even anger. One of the things that we're counseling the patients in the practice where I work is really, most importantly, to stay away from turning to substances. Substances seem like they're an easy out, right? Let's go have happy hours together. But it's a very slippery slope and ultimately not the best thing for mental health. So I would advise her to stay away from substances, and not just her, of course, but all of our healthcare providers and other essential workers out there.
What about for somebody like me who's sometimes maybe at the receiving end of her anxiety or her stress? How does somebody like me help to relieve might not be the appropriate word, but how does somebody like me help her?
That's a great question. So what we can do as those who are supporting individuals who are in situations like your wife is to acknowledge to them that you understand, and that you understand that the stress from her job and the situation, and perhaps even the guilt that she might feel coming back into your home with your mom there, is a very real feeling for her, and encourage her to talk openly about it. There may be a time where she just needs some space in the home space also. So you don't need to continue to say, what's wrong, what's wrong, what's wrong, and give her that space and peace of mind and some time to be able to do the self-care that she needs. And finally, any of us who are supporting individuals, also ourselves can't turn to substances, and also ourselves need to do the things that we have to do to take care of our own health, whether that's our physical health or our mental health. In able to be a strong partner, you have to stay strong and still take care of yourself.
So I can't order like a dozen of wine, dozen bottles of wine
Maybe once,
via
but
Instacart and then drink them all in like, in
no.
1 week, something like that. No, you can't do
No,
that.
no, I don't
No.
want to hear
Yeah,
that,
yeah.
that you've been doing that.
Yeah, in fact, I have not been doing that. But I wanted to just clarify that that's probably not a good idea for me to even contemplate. That's good. Dr. Choudhary, what about, the folks that are working from home, staying from home, and they're working full time, so they're stuck at home. They're not moving as much. They got a stack of like maybe rice and potatoes and noodles at home. And they've got a child or children that they're trying to homeschool, even though they're also working full time. How do you manage those? How do you try and get through the day just to begin with?
It is certainly a challenge, and it's one of those things that all of us are trying to adapt to. If possible, separating physically work area from family area helps with some of that balance. If that's not possible, it is really trying to be flexible with things. I can give you a perfect example. I work from home, and I was in a meeting last week, and my son sneaks up behind me and gives me a hug and becomes part of the whole meeting. And for me, it was a very sweet gesture on his part. He didn't realize that I was in a meeting, and so my point is, if it's possible, be a little flexible. I think keeping that kind of attitude will help with the way children handle these things as well. If possible, having structure is going to be really good. Try to keep the same routine in your day. Wake up at the same time, try to get that exercise in, try to eat right. the tendency is to hit comfort food in situations like this, but try to keep and maintain a balance there, and especially to help children, because sometimes it will feel like a snow day, but other times it'll feel like a very stressful situation being cooped up inside. So help keep that balance.
You know,
I was.
go
If I
ahead,
could,
Dr.
I'd love
Carney.
to
Yes,
build
yeah.
on to what Dr. Choudhary is suggesting. As a mom, I can't stress enough structure, structure, structure. And as a mom who's worked from home for a number of years, it's really important to maintain that strict schedule. So have your kiddo and you wake up at the same time every day, just as you would if you were going to work, and go through the usual preparations, put on work clothes, get yourself ready. And during that time of day that you are working from home, that space should be considered your workspace for as much of the time as you can, so that you protect it and understand that there's a transition from home to work, even if it's in the same place, and then later from work to home. So setting a start time to the day and a stop time to the day. And your kids' schedules, similarly, have them get up, eat breakfast, go for a walk as if they were walking to the bus stop and back, if you can take them for that. And then setting up their schedule that mimics how their schedule at school would work that day as best as you can. You have to be flexible, because younger kids are absolutely going to be more challenging than older kids who can maintain that structure a little bit better on their own. I also really encourage all work from home folks to look at the types of services that their employers may be offering them. Many employers are giving great tips and helping their employees through this. And if there are challenges that might be unique to your situation, I really encourage work-at-home employees to talk to their supervisors and see what kind of flexibility there may be during the day. Perhaps it's starting at a later time in the day and going later so that you can focus on your child in the morning. And if that's not possible, figuring out another way to flex that time with your supervisors.
You know, so what I'm finding in my situation is that it's what I'm finding in my situation. It's very difficult to go back to a structured day. You know, we had a very strict structure when classes are open. Now that classes are closed for the rest of the school year, you know, my son's sleeping late, waking up late. And yes, you know, you mentioned those meetings in which he would just kind of waltz in and give me a hug or a kiss, which is very sweet. But I'm finding it very tough to just separate the workplace from the fact that he's at home, and then having to teach him and educate him. And I can tell you, for example, I have a real great appreciation for what teachers do, but also for the parents that are homeschooling. I don't know how they do it, because I'm struggling. So Dr. Choudhary, any tips for us parents to try and you know, ensure as much as we can that our kids are not super distracted, like my kid, for example, and I'm assuming a lot of other kids in this situation?
Of course, I mean, this is a adjustment on everyone's part, and it will be important to help our children understand that, you know, this is, while we're at home, there's still a structured school curriculum, and helping them with that. I completely agree. I think teachers need to get 1,000% increase in pay for what they do. It's very challenging to have children who are easily distracted and really are struggling with getting their work done. So I completely empathize with you. I think part of what we can do is reach out to the teachers and the school system to see what kind of structured approach they have. Some schools actually are doing a virtual curriculum. For example, my son is in front of his computer at 8:30 in the morning and has school till 2:30. And they are using Google to have classroom settings. So there are some schools that have these curriculums. Others are a little bit more, are a little less structured, but we can get lessons from teachers, for example. So I would urge parents to reach out to the school systems, to the teachers, to see what can be done for our children at home.
I'd like to bring into that the importance of physical activity for kids as well. Kids need to burn off energy. It's important for them. It's good for their mind and body. So to the extent that they can go play in a backyard, or you can take them for a walk at the beginning or end of the school day, or even during a lunch period. That's one of the reasons about trying to work with your supervisor is so important, so that you can build those breaks into your workday that help give your child that similar kind of break in his or her day, so they can burn off some of that energy and not just feel cooped up all the time. And then try to make the school time at home fun. So as Dr. Choudhary said, many schools now are offering Google Classroom or putting curriculum out online so that the kids can stay busy and keep tracking toward goals. So help them track towards some of those goals by rewarding that behavior in any way that you might be able to at home, whether it's a snack or whether it's getting to watch something on TV. Use those things as rewards instead of something that they think they should have. Treat them as another way to help encourage them to earn and work toward that.
So I'm going to take a question from one of our attendees here. And he says, my wife has primary progressive multiple sclerosis. What measures can I take to prevent her from being anxious while in isolation? Dr. Carney or Dr. Choudhary, any one of you want to answer that?
Sure. I am sorry for her having that condition. It's a really tough condition for an individual to have to live with, especially in a time like this. I'm sure that you are anxious and she is anxious, especially if she's on medications that can cause immunosuppression. So first and foremost are those things that will help her feel a sense of protection, that she is being as protected as she can be from contracting the virus through that being brought home to her. So all the hygiene measures that we've talked about previously, all the good hand washing. But from a mental health point of view, if she had contact with her provider's office before to get feedback on her condition, maintain that contact with the provider to see if that provider can talk to her telephonically or through telemedicine. I would encourage her to get involved with a group online to have support for individuals who do have chronic illness. Many of the resources that we've seen, for instance, American Cancer Society, other organizations like that are now hosting online groups. So I would encourage her to find one of those and participate in individuals who are in similar situations. And then finally, if she has a pre-existing behavioral health condition, let's make sure that that's treated adequately. So maintaining medications if she's on those, or talking to her behavioral health provider to tweak those or ensure that the symptoms are being covered adequately. And last of all, maintaining that kind of distraction. So instead of trying to focus and worry, shift some of that to some positive energy of doing something else, whether it's drawing, painting, writing, something that may be creative, but allow her an outlet to get out some of the fearful and anxious emotions.
Again, to our audience, if you're just joining us, we have Dr. Carney and Dr. Varun Choudhary from Magellan Health. Dr. Choudhary is a telepsychiatrist, and Dr. Carney is the chief medical, or was the chief for the Magellan Rx Management. Did I get that one right, Dr. Carney?
That's right. I was in Varun's role previously and then moved to be Chief Medical Officer of Magellan Rx Management.
And we are obviously talking about how to cope with prolonged isolation with this situation that we have when we have roughly 230 million Americans that are staying at home practicing social distancing, or in more than half of the states have had to follow stay-at-home order. If you have questions for Dr. Carney or Dr. Choudhary, just type in your questions through our GChat room, or you can also do it via Twitter. My Twitter handle is @LDelPuerto, LDELPUERTO. I'm going to shift to something maybe more difficult, maybe tougher, maybe a bit darker, if you will. But when you have a situation in which a virus could kill you, and it's very real, and especially real for our older population, and so you're thinking constantly about life and death scenarios. You might have somebody at home who is sick. How do you try and keep yourself from overthinking these things? I wonder. I myself find I find myself a lot of times thinking about life and death scenarios.
I think in a situation like this, it's natural to feel anxiety, to feel fear, to really focus on the number of deaths that have occurred, the number of people who've been infected. That is in our face all the time. I think really trying to find some kind of balance is going to be important. Talking and processing through some of these fears, and really trying to share with family and loved ones, really not shutting down, but opening up and processing. That's going to be helpful, I believe, even for children and adolescents who really are not geared that way sometimes, where they really don't know how to deal with their emotions, and they don't know how to process. And so that's going to be very important. If these things become impairing, if suddenly you find that your anxiety is to the point where you really can't function, it will be important to reach out to your professionals, your healthcare providers, to see if there is something more to it than that. In this situation, people are going to have an impact on the mood, and they're going to have significant anxiety. It will be very important to reach out to your healthcare providers if you're feeling as if this is getting too much for you.
I think that what Dr. Choudhary has said about exposing oneself to the reminders of what's happening, there is an absolute imperative that we have to know what's going on. But I think it's also imperative not to overload on the information. When this first started, I was watching the Johns Hopkins tracker, every hour, just to see what was happening and where the virus was. And I started feeling myself being really drawn into that in a way that started being not healthy, because my focus was on that, and it became something that was more anxiety provoking instead of informative. So if you're feeling that happening, dial back on the news, dial back on the reports, and find the trusted resources that you can and should look at to stay informed without having any of, I think a phrase used earlier today was fear mongering going on. I think we should also take occasions like this to remember the importance of planning. And while it is really challenging and not something that we like to do, planning for the future, whether that outcome is a good outcome or a bad outcome, is critically important. So ensuring that we have advance directives done, ensuring that our legal paperwork is done, that our partner or family know where to find documents in case of the worst case scenario. But that kind of planning actually can be very anxiety relieving in many ways. And then finally, if those symptoms of anxiety do become overpowering and affect your sleep and your mood and your physical health, it's time to seek help from a provider. And many providers are still actively available through televisits. So you don't have to leave your house. You can dial in to televisits very easily in the way that many companies in many states have made those readily available for folks now.
You know, I've read situations in other parts of the world in which the deaths have been mounting, and in many instances, family members or friends are really not able to to properly say goodbye to somebody who has died, and so the grief is very real, and it's a very difficult situation. I wonder, Dr. Choudhary, how do you deal with if you know, if I'm hoping none of our attendees, none of us are going through this one, and none of us will go through this kind of a scenario. But if some of us are, how do you deal with the grief and our inability to say properly goodbye to somebody who died because of this pandemic?
Yeah, that is a very good point and a very difficult situation. And I certainly feel for somebody who's in that kind of position. It's going to be important for us to really try to express how we feel and to let our loved ones know what we're going through. Something like that is always going to be an extremely challenging situation, and these times, more so than others, that can certainly occur.
Dr. Carney, do you want to add anything to that?
Sure, I'd love to. I think that this brings up the importance of being able to stay connected through the old telephone or our smartphones today, or through screens the way that we're doing now, so that we can have connection with loved ones. Another tactic to look at is, while we may not be able to have a memorial service or a funeral today, to work on planning that for a future date and time, so that that concept isn't lost on a family, that they still will have an ability at some point to gather together and to honor an individual who may have passed away. And doing what we can to tell stories and to connect with one another about the individual. Finally, it's supporting that individual in a way that we might not have thought about before. Maybe we would have brought a covered dish to their house before, so now let's have something delivered to them, making sure that we can support them in other ways.
Again, to our attendees, if you have questions for Dr. Carney or Dr. Choudhary, don't hesitate to type in your questions to our Zoom chat room, and we'll try to go through those questions, as many questions as we can. Here's one question that I often had to worry about. Should I worry about decontaminating the groceries that are delivered to my home? Dr. Carney, Dr. Choudhary, any thoughts on that?
I think that's a common fear at this point in time right now. Just keep in mind that that when we are getting groceries and we are looking at surfaces, more often than not, we're not having to really become very, very concerned with the paper bag, the groceries coming in. The chances of actually getting coronavirus transmitted in that way is extremely low. So just keep in mind that we're not going to be able to cover for everything. We're going to have to understand that there are certain things that are going to be out of our control, but the transmission of coronavirus in that way is extremely low.
Thank you for that. Dr. Carney, you were going to say something, ma'am.
Sure, I said I couldn't agree more, and I would just add, wash your hands afterwards. So you're emptying the grocery bags, putting your stuff away, wash your hands before meal prep. Kind of wash your hands all of the time, and then avoid as best you can touching your face, your eyes, your nose, because that is one of the ways of transmission.
So I want to ask Dr. Carney, How does a company like Magellan deliver services when we're self-isolating, when there's a stay-at-home order? How do you go through making sure that your patients are well, and how does that look like?
So we do it in several different ways, and I'll start and have Dr. Choudhary jump in. From a PBM perspective, the pharmacy benefit management perspective, we do whatever we can to support individuals when they're presenting for early refills or for refills. We also offer delivery and mail service so that individuals don't have to leave their home to go to the pharmacy. In some of the care management programs that we run out of Magellan Rx Management, we have done analytics to look at individuals who might be most at risk for developing anxiety or depression, and do outreach to those individuals to check on how they're doing from a mental point of view, as well as how they're doing from a physical point of view, to ensure that they have what they need to stay healthy in their homes. Analytics are a great way that we have been able to identify individuals like the woman we talked about earlier with progressive multiple sclerosis, who might have that higher risk and need that extra sense of social connection. So our case managers are reaching out proactively to do that for individuals. We also are actively participating across all of Magellan Health and working with state governments and county governments, as well as the federal government and various organizations, to work hand in hand with the policymakers making decisions to ensure that they get the perspective of keeping our nation healthy as a whole.
And
yeah, go ahead, Dr.
Carney.
Choudhary. Yeah, go ahead, sir.
For Magellan Health, we are doing similar activities. We have paired with our health plans and with state governments to make sure that providers have all of the resources they need to continue seeing our members. We have opened up as much as we can with telehealth. We've gotten into partnerships with some of the bigger telehealth providers in order for us to have that kind of access. We've opened up the ability for healthcare providers to speak on the phones with their patients as well. So in an outpatient setting, a psychiatrist can still see their patients via video conferencing, FaceTime, Skype, telephone, however possible. So that way we have a continuity of services. And for those individuals that are experiencing anxiety and issues with the current situation, we've opened up things so that way our customer service representatives can direct people in the right direction to get them the services they need.
For somebody like you, Dr. Choudhary, who's been practicing telepsychiatry, this comes pretty natural to you. I want to go through some of our audience questions. Here's one. Here's one from Robert McCormick, and he says, like many employers under the shelter-in-place or stay-at-home order, what else can employers do for employees? Employers do for employees aside from promoting telehealth, for example, and having employee engagement through wellness programs. What about healthy habit to what kinds of healthy habits can we start to adapt? And what recommendations do you have with regards to communications to employees? Is it better to over communicate or not during a crisis like this? What's your recommendation, Dr. Carney?
Well, those are great questions. So let's start from the wellness perspective before getting to the other parts of this. It's really kind of a fun time to have an opportunity to roll out different sorts of wellness activities to your employees. So those might be a workplace challenge of a weight loss program, an eating well program, or even an exercise program that someone can do. How many steps a day can you take while still working from home? Those sorts of things. Join employees together over Zoom or FaceTime, whatever works for the company, so that you could even do an exercise challenge together or a yoga class together, something that's focusing on wellness and health. Make it fun. Those activities in the best of times can be fun, and now in the worst of times can still be fun, as long as we find that we're connected to one another and have the ability to laugh at ourselves as we go along. I think that communicating to employees is absolutely critical. I don't know that you can over communicate. You don't know when and what kind of information is going to hit an employee who needs it. So maybe it's something that they already thought that they knew, but still can learn something more. They'll want to know what's happening in the workplace. How secure are they in their jobs? What kind of flexibility do they have? What perhaps are long-term plans as you have them and know them that you can roll out to your employees. Tell them what is happening in terms of, as you anticipate the workload changing or the type of work that they're doing may be changing. Communicate as much as you can and communicate as accurately as you can to them. The last thing that when an employee wants to hear is something that sounds really good but may not have the truth behind it that they really are clinging to right now. It's also really important to be upfront with employees about how flexible you can be in their work from home situations and be able to support that employee and their family. And finally, I think it's important in the communication to continue to reiterate the message that there is a lot that's changing day to day, sometimes hour to hour. A new declaration may be made by the president or a governor or a county official that at noon was different than it was at 8 a.m. And so asking for that flexibility from your employees as you're trying to figure it out as well is important. Make that be a two-way communication.
So I have a couple questions here that center on face mask, and I don't know if you want to answer this question, but one of our attendees says that that's one thing that's very annoying is the conflicting information about face masks. And the question is, there are reports that the virus can float in the air up to 3 hours. There are the CDC guidelines on social distancing and washing hands frequently when you're out. One attendee asked, when going out into the community, should we be wearing a mask at the very least as a reminder to not touch our faces? And are we to assume that, and if we are to assume every community has a virus, is it not safer to have masks? And this may not be your areas of expertise, but I wanna hear your thoughts on this one, if that's okay. Dr. Choudhary?
Sure. So originally, the CDC had explained that wearing a mask is not going to protect people from necessarily getting the virus. It'll protect them from spreading the virus. So if you're sick and you're wearing a mask, that's protecting other people. I think things have generalized where a lot of times it is that touching of the face, you touch a surface, you touch your face, that kind of activity is what masks will probably help us to prevent. Given the fact that there is a shortage of masks, when we go out, it's more of, again, washing our hands, being very aware of the information that the CDC has given us about surfaces and what's going on. The social distancing is going to be important. Wearing a mask will help you remember all of these things, but you don't necessarily need to wear that mask if you are, unless you are sick and don't want to spread the virus. So that was what the CDC originally had said. There have been different things that have been going around, but I think that the consistent message has always been the social distancing, being aware of what you're touching, washing your hands, and be aware of not touching your face.
I have another question here. Is telehealth available for people who do not have health insurance? Dr. Carney, any thoughts on this one?
I think I don't want to give a solid answer on that because I would expect that it might vary state by state or even county by county on what services are available for the uninsured. So telehealth may be available to individuals through community behavioral health services, which could be available for individuals who are uninsured. So I would encourage whoever asks this question to really look into what their community and whether that's their city, their county, or their state may be offering. Also, if that individual could be eligible for Medicaid, he or she can still apply for those kinds of services today. While we're working from home, services are still available to individuals in terms of what we are eligible for to receive. If telehealth is not an option for this individual, I would strongly encourage them to look at online resources that may be optional through services like the various apps that are out there, or even other telemedicine, or not telemedicine services, but online services that someone can access. We have cognitive behavioral therapy programs available that can be accessed online, apps that deal with stress, that deal with anxiety, that promote meditation, that promote mindfulness. Those may all be something that will help this individual if no other services are available.
I think I think we can accommodate just one more question, and then we're gonna wrap it up. Here's a question: how does this apply to an out-of-country visitor stuck in the U.S. who doesn't have a local doctor but is low on prescription drugs? What are their options? You're a tourist in the United States, and you're stuck here. Presumably you don't want to get on a plane and potentially infect yourself, because that might be a place where you could potentially get it. So what about for those who are visitors from other countries who are stuck here? Any thoughts on that, Dr. Choudhary or Dr. Carney?
There are a number of organizations that are actually providing telehealth services, and it's a small fee that individuals pay who may not be going through insurance companies. So there are a number of different resources available, a number of different providers and different companies that are offering telehealth services for specifically situations like this.
Thank you for that. I want to thank again Magellan Health for sponsoring this program. I think it's been very informative. It's provided me with certain things that I kind of instinctively knew I had to do. For example, like providing a structure at home for myself and for my kid. And I hope that our attendees also have learned a lot. Dr. Carney, I want to ask you any closing remarks. Also, Dr. Choudhary.
My hopeful closing statement is that we all do need to have hope. I practiced in a time when HIV/AIDS first came to America, and at that time it was a death sentence. It is not. It has become a chronic disease because we have ingenuity and smart minds and innovation. All of those same types of people who have cured diseases in the past are focused on this, whether it's for treatment or vaccines. So we have a great country and really, really amazing people who are in the scientific and medical world trying to find a fix for this. So maintain hope. We'll get there. We may have a few hard months. You're all adaptable. You can do it, and we'll beat this thing.
Dr. Choudhary?
I can't agree more with Dr. Carney's message. Crises like this sometimes can bring out the best in people, and it is really coming together as a community, as a society, as a country that gives us the strength to be one of the best countries in the world. I think people should remember that we've got people working on this 24/7, and it's really the communities coming together, people coming together that make us the strong country we are. So continue with the hope and that positive energy.
Thank you again, Dr. Carney, Dr. Choudhary. This has been very informative, and thank you for your expertise. Thank you for the advice. Stay well, keep safe, and to our attendees, remember, don't touch your face, which I think I did a couple times during this forum. Don't touch your face, wash your hands frequently, and have a wonderful rest of your day. Thank you again, and bye for now.
Thank you so much.
Thank you. Thank you very much.